I'm Chrissy Geeson, and I'm a physical therapist with Bond Support. Physical therapy after joint replacement is extremely important to help you make sure that you restore your range of motion to full and pain-free. We want you to be able to do things that you were doing before you had your replacement, as well as be able to maybe do a little bit more. We want to make sure that you're strong, your motion is good, you have good flexibility, and you're able to walk or dress and bathe yourself without pain or restrictions. After a joint replacement, you could be asked to walk early while you're in the hospital. Early mobility is key with a hip or knee replacement to decrease your risk of a blood clot and just to continue to move. We don't want you to get a contracture where your joint won't move. When you come into therapy, if you have a shoulder replaced or a special hip replacement done, we can review all of your precautions as well to avoid dislocation or failure of your joint. Your physical therapy treatments will range. So in the beginning, we might begin with gentle stretches and easy strengthening. But as you progress, we'll start to add more weights using the bike or the arm bike and just adding more functional things throughout your life. At each stage of physical therapy, your therapist will give you a home exercise program. It's important that you understand what they're instructing you to do and for you to perform your exercises at home. If you don't continue to do your home exercise program, negative things can occur. You might not have appropriate range of motion, your strength may lack, or you just might not get the optimal results that you can achieve with your joint replacement. Before having your joint replaced, it's important to make sure that you have adequate strength in your legs or in your arms. So sometimes seeing your therapist before therapy can help to give you a home exercise program to make you strong enough. Sometimes surgeons like it when you come into therapy before, just to make sure you have your home set up correctly before you have your joint replaced.